So here are some other ways on the screen that we can take action in our own lives. So the first is joining community programs. So you can seek out and participate in local health initiatives that are aimed at improving access and outcomes for marginalized groups. So the options for your involvement, they can depend on your experience, they can depend on your comfort level. There are opportunities to volunteer, opportunities to attend events, or opportunities to share resources. I believe you all will be getting a copy of this webinar in your emails when we sign out here. You can share this, you can provide this to other people and let them know that this exists, and also other resources in your community. If you find organizations that are really helpful, if you find resources that are translated or that dive into one of these aspects that is important to you, share it with your community, let other people know. Another strategy is, and this one can be really difficult to navigate, but it can be just as important. So you can review and advocate for your own healthcare. So you can take a look at your insurance benefits. You can read those explanation of benefits that we all receive every year from our insurance companies, those long multi-page documents. You can look at your coverage document. And once you kind of have an understanding of it, or if you have an understanding of it, you can speak up for yourself, self-advocate if you are encountering barriers to accessing the care that you need. So this can look like requesting interpreters, requesting cultural liaisons, or at the very minimum, it can be asking to speak to someone who can actually break it down for you and provide more detailed information. A lot of insurance companies do have someone who will pick up the phone and talk to you and explain your benefits to you in layman's terms, not in the very detailed information that we get from our insurance companies. You can also advocate for a change in your own community. You can volunteer, join local health councils, organize awareness campaigns in your own community, and it can really elevate the issues you care about. Again, these issues impact everyone. There's a wide berth of them, and so you don't have to solve everything. You can talk about the ones that impact you, impact your community, your life, your family, your friends, and elevate those, educate about them, which moves on to education in communities. So you can empower others through education. You can share your knowledge and your experiences. Jasmine just shared a personal story about how she was able to get the healthcare that she needed. And for her, it was finding a provider that looked like her, finding a provider that understands her own culture, her own issues, and who has probably seen this before in other people that look like them. So you can share your own experiences to help educate people. For me, it was really learning about the lack of research around some things. I was doing a lot of my own research to figure out what could be the possibility. And I share that with others. Jasmine and I are actually here today because we talk about it, because we educate each other on it. So talking to people and sharing your own experiences in whatever your comfort level is can really help to start making those changes, making it okay to talk about, making it okay to understand. You can educate people about their rights, how to navigate the system, and help people find resources and support in their preferred language or somewhere that's nearby where they live. And then finally, you can kind of vote with your dollar. You can support equitable providers. So you can research providers and organizations in your area that demonstrate outwardly a strong commitment to cultural competency, to understanding, and to serving diverse populations.